I'm Faquer, that's not me. And I work on a digital maturity program at NHS England. So I'm going to give you a little bit of a background and overview why we're doing this and what our ambitions are and where we are so far on this agenda. So first of all, we are responsible for managing and allocating the funds, the nursing and integrated digital care funds. And there are a set of commitments that have been made, and the latest, the NIB framework that has been published in November. So there's several commitments there that the NHS has to go through this revolution in terms of achieving better use of technology, and there is a need to have a model that will be able to evidence achievements and also to monitor progress at the same time as setting some aspirations for the organizations. And the first indicator that we've used, and is the only thing that we have available at the moment at kind of a national scale, was the CDMI, the Clinical Digital Maturity Index, that was developed by EHI. And that gives us a view of the installed capability in acute trust. So what we are doing is not CDMI. So what we're doing goes beyond installed capability, or not even installed, because it just assess what the organizations bought, and they have no views if and how this has been installed, what capabilities have been turned on, and how those systems have been used within the organization in terms of penetration and effective use of those capabilities. So, and that's what we're trying to do. We're trying to create a set of indicators that we're going to be able to demonstrate achievements and monitor progress. But it's something that's going to be looking into effective use of technology and also interoperability. That's going to cover all care settings. It's not just for acute. It's acute, primary care, community, mental health, and social care. We are building on existing evidence and existing models. So there, you probably know about the HEMS, MRAN model that's well used in America and other countries, and there are others that are used in Canada and other countries, and also models from other industries. So we're looking at all of that and trying to learn from those models and see what is suitable for the UK, and then creating a model for the NHS. This is kind of the program, the program evolution. So first we had this deal with CDMI, with EHI, where we bought the access to that tool to the NHS to use. So it's free to the NHS to use because we pay for it. So they FOI the NHS to get information, and then NHS has to pay to access the same information. So we're not going to keep on working on that same model. That's why we're creating something new. And during this year, we've been developing a data set on interoperability across settings, and we're also looking at effective use of systems and effective use of capabilities. The capability that we've been exploring the most so far was e-prescribing system, and now there is a pilot that we are running in collaboration with the West Midlands Academic Health Science Network. So there is already a pilot that's going to be sent to organizations in the area to test the model for e-prescribing. And then we're going to collect the results and the data that we're going to capture and reevaluate or redesign the model. And that is going to be then part of the acute model, the mental health model. So we're testing e-prescribing capability and interoperability capabilities, other aspects of this digital maturity model, and I'm going to show to you in a minute what aspects we're looking at. And then they all are going to be collated into a single model to acute, a single model to mental health, primary care, social care. So those are our stakeholders as per has been published on the National Information Board framework. We are working with all those stakeholders. So we have a deadline set by the NIB framework that by October next year, a digital maturity indicator will be part of or be presented to patients and public through choices. So that is already a commitment there, and that's our deadline, October. So that data will be used by CQC. So we're going to be sharing that information with CQC. That's already is part of the framework, and other organizations as well. So will be part of the standard contract. So the providers need to make sure that commissioners have access to their information on their digital capabilities. And also to inform the industry and Health Education England as well. So by March of this year, what we're going to be delivering is this first draft model for acute, and then move on to collecting data. So it's going to be a rollout phase that might take place between April to July. So then we have time to cleanse the data and then be able to publish something before October. Our delivery group, we were working with a set of partners, and we share same or similar ambitions with academic health science networks, and we decided to work in collaboration with them to make sure that whatever they're doing is something that's not going to be just for one region. At least that we're going to guarantee there's going to be a core data set that is the same across the country. So academic health science networks, some of them are already well ahead on the game, and for example is UCLP, University College of London Partners. They contracted or they commissioned from HIMSS to assess the organizations in North London. So they were already looking at assessing the digital capabilities of those organizations. That has been done already. So instead of going and create something totally different, we're learning from that experience. And there's a lot of things that they realize is not applicable for our organizations. HIMSS model it doesn't cover outpatients, doesn't cover primary care. There's a lot of gaps in that. So we're working with them, and also with Oxford, with Great Manchester, and as I mentioned, in e-prescribing, we're working with West Midlands. So working with them in collaboration to make sure that we design something that's fit for purpose. Also, all the CIOs are invited and will be invited to collaborate with us and have a view, because the idea is that we're going to deliver this toolkit that will help them to set up their business cases. That's something that they can take to the board with them. It's going to help the procurement process. So it's a tool for them to use, as well as something that can be to share information and provide the organization's digital maturity profile. So those are the aspects that we are aiming to cover. So there are 9 aspects there, and we're looking into all of this. So the CDMI from EHI delivers one part of that infrastructure, and that's the whole thing that we are looking into that goes much further than that. And we're looking at 4 levels of digital maturity. So it's the stage that you have the technology in place to support the delivery of care, then it's supporting the delivery of the care, but it's also totally integrated, so it's the integrated digital care. And then it's making better use of the information, making use of the information in the system to improve care, and also meeting service users. And applying the levels to the aspects, we will end up with something that's similar to that. So you have an organization digital maturity profile. It's not an index, it's not a number. So it shows the strength and weakness of that organization in terms of digital maturity. So it gives an indication to the organization where they have the areas that they need to prioritize, and also gives us as NHS England an indication of first who needs support and what support do they need. So I will stop there because I've just been left to I'm supposed to end this at 12:05, and I'll just put our vision statement there, and I will be happy to take questions from you, so then we can have a more of a discussion about it.